Sarah, please give us your definition of what postpartum hair loss is, and then kind of go through, you've been talking about what is going on with your own body currently, 7 months postpartum.
Yeah, I think it's always important to kind of start with the growth cycle of the hair, right? Just to kind of recap everything you've probably I talked about, I'm sure, on my last podcast, and I could talk all day about this. There are 3 phases to the growth cycle of the hair. The anagen phase, this is the growth phase. So this is when your hair is actively growing. This can last anywhere from 2 to 6 years. Unfortunately, as we get older, we go through that phase a little bit faster, and that's why it's harder to grow your hair thicker, longer, stronger when we do get older, particularly post-menopause. I'll kind of talk about hormones related to that too. And this is all normal. No matter what, every 2 to 6 years, this hair is going to grow. It's going to reach to a terminal stage, which is the end stage hair, and it's going to fall out, and a new one's going to grow behind it. The catagen phase is this transition phase, essentially where the blood supply detaches, and it kind of just is hanging out there. This can last anywhere from 2 to 3 weeks. And then the telogen phase is the resting phase. This can last anywhere from 3 to 4 months, and this is when you'll see like an active shedding happen. Like I said, due to genetics frequently, and additionally to hormonally, and as we get older, this hair life cycle can shorten. There are many different types of hair loss. In particular, the most common thing that we see is androgenetic alopecia. So that's female pattern hair loss. And most women have a degree of this at some point in their lives, particularly as we get older. That and telogen effluvium. So that's that temporary period of shedding. Telogen effluvium can happen due to stress on your body, physical illness, nutritional deficiencies, emotional stressors, anything like that. That can be in itself postpartum, where you're potentially stressed and sleep deprived. So we'll talk more about things like that too. But the telogen effluvium that you're going to experience in postpartum hair loss is essentially hormonally related. No matter if you're getting enough sleep. Fortunately, knock on wood, I have a good sleeper. No matter what I've done each pregnancy, I've had a period of shedding, and I'll show you too on my own scalp really where this kind of happens to me. And it's a very, very commonly seen place hormonally that we see with female pattern hair loss later in life too. So it certainly makes me realize that I will be prone to this later in life if I don't, really work on it now and prevent it now. Otherwise, I would certainly be at risk for it later. So if postpartum hair loss is something you've experienced or you do experience, there are things you can do preventatively for later that you won't really end up with these female pattern type of patterns of loss later in life. Other things that we see here, not so commonly, but we do see are traction alopecias. So those are really from like tight hairstyling, braiding, things like that. And then really those scarring alopecias. So CCCA, LPP, things like that. Those are more of a inflammatory type process. And then alopecia areata is a autoimmune disorder. And we'll talk a little bit about that, but primarily we're going to focus on the hormone shift that's seen in pregnancy. So, we deal with other things here too, like post-cancer hair loss. But again, these things are all really essentially treated a lot differently. Kind of the way we start. So we start a consult, we'll have you come in. We want to determine the cause. So we'll take a detailed medical history. We'll take a detailed hair health history, hair loss history. We'll do a very kind of intense physical exam of your scalp. So we'll kind of do our own evaluation. We'll do pull tests. We look at you under a trichoscopy, which is a microscope, to see if we see any signs of anything autoimmune, inflammatory, things like that. We frequently do blood work. Primarily for everyone, we check blood work, unless it's something people just like, it's just this happened to my mom kind of a thing. We usually will always check like thyroid, iron, vitamin D. Depending on your age, we may want to check some hormone levels, things like that. If anything really is suspicious to any of the practitioners here, we'll get a biopsy. We don't do that frequently, but I will tell you more often than not, if we aren't 100% sure of what it is in your consult, we'll usually want to get a biopsy, especially if the blood work doesn't show anything. We really would want to get a biopsy to see exactly what's going on, because that's going to be diagnostic. And the reason we really focus on getting you the right diagnosis is because this treatment plan can really vary greatly depending on what type of hair loss you have. So any of these autoimmune reasons, we're treating with really a lot of steroids or oral medications, things like that. For a scarring alopecia, we really need to control that inflammation before you're really a candidate to do any other types of treatments. So it's very variable, and getting that diagnosis is the most important thing. Let's really focus on the postpartum aspect of it. So telogen effluvium, like I think I've said a couple times now, is a temporary period of hair loss. So it's a period of shedding that's either an insult or a reason in your body, hormonally, nutritionally deficient in something. It's a temporary period of hair loss that once that insult is removed, it will return to normal. So a telogen effluvium from an illness can essentially get better on its own. Same thing with pregnancy. I have a nice chart kind of that describes the hormones in pregnancy. So progesterone and estrogen are the main hormones of pregnancy. Estradiol levels premenopausal are going to be anywhere from 30 to 400. And those are like based on your cycles monthly. Postmenopausal, it's only 0 to 30. So at the highest postmenopausal, you're only going to be where someone is at the lowest number premenopausal. It's kind of a big fluctuation. And so premenopausal, again, I said 30 to 400. Pregnancy, this number is 15,000 or higher. So as you can see, the estradiol is why in pregnancy, your hair does get thicker, healthier, and this is really the reason, your estradiol levels. From personal experience, and I probably didn't realize this when I had my first, he's 6.5, and just being pregnant about 7 years ago. I mean, I just, I wasn't paying attention. When I would wash my hair this pregnancy, I would lose one hair maybe every other day. I don't know what, Britt, is happening with you. Typically, I shed a decent amount. I run my fingers through. I always get like a couple at a time. When I was pregnant, 0, nothing would come out. So you actually really will have a lot more hair to lose after you have a baby. So that is another reason why it feels like it's so much hair. But in reality, you haven't lost any hair in almost 9 months. So you've been in this growth, and it's all in the growth phase. So all of this hair is just growing and getting thicker and stronger. I mean, I think every pregnant woman I see, I always look to see like, oh my God, look at her hair. It's amazing. We also know that like a lot of postmenopausal women take hormone replacement therapy with estrogen, and this can actually make the testosterone levels fall. So that testosterone is really what can break down the hair follicle. It's the byproduct of testosterone, or DHT. We here really don't advocate, however, for hormone replacement therapy for treating hair loss due to the many side effects. I won't really get into those now. We don't use hormone replacement therapy here. Oftentimes, if you're going to use anything estrogen wise, we want it balanced with progesterone. Using anything that's progesterone heavy, even birth controls, and we'll talk a little bit more about that later too. Progesterone only can mimic testosterone. So we want to caution that too. And testosterone, like I said, can break down the hair follicle. So we really, really want to be careful with playing with hormones. So like I said, in pregnancy, the anagen rate increases. So your hair follicles will stay in that anagen or growth phase longer. That's how the hair gets thicker and longer. It really stays in that cycle. After the delivery of the baby, the sudden kind of drop in hormones, this anagen rate will decrease, and then the telogen rate increases. So you kind of have this happening. You have this anagen rate, all the growth, and then you have a telogen rate. So essentially you're growing and then you're losing, unfortunately. This leads to an increased shedding, and it's typically around 3 to 4 months, sometimes upwards to 5. You might start to notice some very minimal shedding like right after birth, but really it peaks around 4 months postpartum that you'll start to notice shedding, and then your hair will start to regrow. So I so badly wish I could show you this, and I don't know if this is going to be helpful or not. Okay, so the red is the HCG. So that's your pregnancy hormones that you test for, and you get like a positive pregnancy test with. That number's super high and then drops off pretty quickly. As you can see, your progesterone in the green and estrogen in the blue, that rises throughout your whole pregnancy. And where that arrow is, that's the delivery of the placenta. So as soon as you deliver the placenta, you have your baby, you'll deliver the placenta. When that happens, those hormones drop. And it's so interesting because the estrogen and progesterone drop that you experience post-baby after you deliver the placenta will be at their lowest until you ever get into menopause. So eventually they will like come back up and regulate, but it's just so crazy that after you give birth, it will be the lowest. And you'll potentially see it too, Brittany, like after you have a baby, sometimes your body is just shaking. That's your body releasing all these hormones. And it's just so crazy until you go through it to realize like what actually happens. But it's really that release of estrogen and progesterone. All of these changes that happen, the growth during pregnancy, the loss after, it's all hormonal, really all hormonal. And we'll talk about things you can do, a healthy diet, managing your stress. I personally was taking postpartum Nutrafol, like the day I delivered, I brought it to the hospital with me. No matter what I did, I still had loss to my temporal region. So here, and it's growing back, you can probably see now those little baby hairs there. And over here, this is my bad side. Do you see how bad it is there? But I will tell you, I've looked back at pictures to see Did this happen each time? Because I had my first and then pretty quickly got pregnant with my second. So I don't think I noticed it as much because I got pregnant so quickly and the regrowth happened so fast. But after my second son, I had a 4-year gap in between my next pregnancy. With my first, I attributed it to like, oh, I must have been because I've been lightening my hair too much. It must have been from the bleach breaking it off. It was all hormonal. It was nothing I did, nothing I could have controlled, unfortunately. There's things you can do later once it is in the regrowth stage, but unfortunately there is a period where you kind of just have to let it happen. Telogen effluvium is not going to have, this postpartum hair loss isn't going to happen to everyone. So it might just be, I think the statistic is 30 to 50% of women that it happens to. The more people I talk to about it, the more of my friends and other people, it's more than 50%. The majority of women start to lose hair. And I think part of it is that lack of shedding you go through during the actual pregnancy, right? So like you're not losing any hair and then to all of a sudden go back to like a normal shedding phase, maybe a little bit faster than normal, is really can be dramatic for people. I just want to stress how important it is to know that this is temporary. Once your hormones regulate, breastfeeding seems to be a little bit of a buffer. I breastfed all of my kids like similar amount of times. As soon as I stopped breastfeeding, I noticed it did get worse, but it just depends what works for your lifestyle. I'm not saying continue to breastfeed so your hair doesn't fall out. It's going to happen anyway, if you're breastfeeding or not, if it's going to happen to you. And there's no way to know until you go through it. Like I said, there's nothing you can do to prevent this hormone shift from happening. You can talk about like birth controls that you can use to kind of regulate those hormones after, if that's something you're interested in doing. But time really is just to let your body regulate post baby is what's most important. I will tell you from personal experience, we had some fertility issues trying to get pregnant with number 3. And knowing that really they don't even suggest trying to go for another baby or doing any of this testing for really 18 months after a baby. I don't feel like I feel really normal physically or mentally until my babies have been like about a year old. And that's just how long I personally think, and what the research kind of shows, if you did want to safely have another baby and let your body kind of readjust and re-enter into a normal cycle, takes about a year. So I just thought that statistic was interesting when I was like learning about all this stuff. Letting your body kind of do its own thing hormonally is the most important. Big things you can focus on postpartum that are helpful are going to obviously be nutrition, managing your stress, understanding the underlying changes in immunity that can happen, and potentially like this aggravation of an underlying female pattern hair loss. So I obviously am a person who's prone to that. I already had like temporal thinning and it just seemed to get worse postpartum. So I know that for the future, for me, it's something I'm going to really want to focus on. Breastfeeding and pregnancy, you really should be focusing on at least an additional 350 calories a day, balanced whole foods, less processed foods. So even if you're craving all these fried things all the time, just try to remember it's not about like the weight gain. It's really about maintaining a healthy, giving your baby those nutrients, eating high protein, vegetables, fruits, nutrients that are going to really feed your baby. Your OB is going to recommend supplements, of course, a prenatal vitamin with or without iron. I know that this is another example of having a baby later in life. With my first 2, I didn't have any issues. And then at 37, delivering at 38, my iron was super low. I noticed I was getting winded all the time and thought it was very strange. I was like, there's no way my iron's low. It didn't happen to me the first time. Every pregnancy is different. As we get older, it's harder to. So I ended up with like super low iron. I was taking additional iron supplements. So just make sure your OB is going to check all these things, but making sure you're getting enough iron in your diet. I actually have a friend who every pregnancy she's had has always had low iron and she would crave red meat, and she's a vegetarian and would eat red meat during her pregnancy. So I thought that was so interesting that her body was craving the iron and she would actually eat red meat when she hadn't in years and years. Vitamin D, you really want to be taking upwards of 600 IUs a day. Iron, we mentioned, the folic acid is 600 micrograms. Omega-3 fatty acids, these are all going to be in your prenatals. Vitamins A, iodine, B6, and Britt, you said the B12, super important for immune health too. Deficiencies in vitamin D, iron, and protein have kind of shown to clinically aggravate these telogen effluviums. This can certainly happen during pregnancy. Just be aware of those things that, sometimes these babies, they do chew up things in your body. Postpartum, you really should be on a vitamin D supplement, in my opinion. Personal experience after my second, about a year later, I ended up with a stress fracture in my foot. No idea why. It was the start of the pandemic. So I was running a lot outside and had my blood work done and my vitamin D was low, and babies just chew up your calcium postpartum. So you really have to make sure you're keeping those dentist appointments, things like that. And I'm digressing, but like, it's just so crazy what happens postpartum. A lot of women will notice that they get sick a lot during pregnancy. And that's kind of because, your immune system is adjusting itself to prevent your body from rejecting this fetus, essentially. Stress, obviously, stress is one of the most common reasons for excessive shedding, even if it's unrelated to pregnancy and hormones. I think I had mentioned, the struggles I went through after my first was born. Making sure you have a good support system to manage that stress is super important. You're going to have increased stress in the postpartum period. You're going to have some sleep deprivation for sure. Your cortisol will probably rise because of these two things. If unfortunately the postpartum depression or anxiety is bad enough and you need medications to manage it, some of those medications can actually cause a temporary telogen effluvium. So there are so many factors that can play into these things. But like I said, the main one, and sometimes treating it, not treating it, you just have to go through that hormonal shift and let it happen, and it will get better. But maintaining a healthy diet, managing your stress, getting enough sleep, easier said than done with a newborn, it will get back to normal. Sleep deprivation can cause increases in inflammatory markers, cortisol, and that can lead to increased shedding and telogen effluvium. So truly focusing on getting that sleep when you can, even if it's the middle of the day and you have a million things you need to do, but you're exhausted, get the sleep over, folding that pile of laundry or something. Have somebody help you. Have to take care of yourself, or you're not going to be able to take care of the baby. So make sure you're getting enough sleep. And it's all cyclical. If you're stressed out, you're stressed about your hair falling out, you're thinking about that all the time, it's just going to continue. So just always to keep in the back of your mind, this is temporary. It will get better. My hormones are going to regulate eventually. I will feel better mentally, physically, and my hair will stop shedding so much. Particularly if, you're like kind of maybe where I am, like 6, 7 months, 8 months, 9 months, and you're still shedding a lot. I do encourage people to come in and have, at least some blood work done. Let us take a look at your scalp just to ensure there is nothing else going on. We really want to make sure it's not anything else like an underlying autoimmune or scarring alopecia. During pregnancy, some women with autoimmune disorders do have changes with their hair. Interestingly, alopecia areata, which is a patchy version of hair loss. Hair growth can actually improve. Rheumatoid arthritis, it can improve. Lupus, it often worsens. And thyroid disorders can really become imbalanced during pregnancy as well, which result in increased hair loss. This inflammatory response when you are pregnant is really in flux during pregnancy. And so there's so many changes can happen. If you have known female pattern hair loss prior to pregnancy, you are certainly at a greater risk for postpartum telogen effluvium. A lot of treatments should be discontinued before you do get pregnant. So we don't want you taking minoxidil orally or topically. We don't want to do PRP treatments. We would stop spironolactone if that's a medication you were taking for your hair or your skin. Obviously, we stop birth control pills. Is going to be laser therapy. So that's a laser cap that you can use. So if you do have underlying androgenic alopecia, thinking about starting a family soon, laser is really like a great option because it's something you can continue throughout the pregnancy and the postpartum period and through breastfeeding. So I think a lot of women don't often take great care of themselves after childbirth. So important to try to get enough rest. A lot of times, even postpartum, some women might be anemic. So taking iron continuously throughout the postpartum period, they will check it at your postpartum, like 6-week checkup. Just make sure that maybe you need to continue that. And if you're not planning on nursing and you do have underlying female pattern hair loss, you can restart taking your treatments for your androgenic alopecia essentially right away. Postpartum, your OB is going to talk about birth control with you, where you are in stages of life, if you only want one child, things like that. But if birth control is something that you'd consider, there are certain birth controls that can help your hair, especially if you have a history of female pattern hair loss prior. We really strongly would encourage you to consider using an anti-androgenic like birth control or low androgenic. So these are going to be things that are balanced with both progesterone and estrogen. A lot of IUDs do actually still have just progesterone in them, and that's highly androgenic, which means it can mimic testosterone and can actually cause some shedding. So you just want to be careful about that. Paragard is a good one if you're going to use a IUD, but we can make recommendations of types of birth control as well if you want to talk about any of that stuff. And there's a ton I can always discuss. So a couple takeaways. It's really variable. between people. If I take a poll of my friends, some people didn't notice any changes with their hair. Just remember that this will resolve in 3 to 6 months with really essentially complete regrowth within about a year. It's not fun to go through, but it is really reassuring knowing, okay, my hormones are going to regulate. This is going to stop and it will get better. If you have a history, of this, and Brittany, you had a pretty bad TE post-COVID. Most of the time, you are probably at a higher risk of having a postpartum telogen effluvium. Your body just responds differently to these stressors. So just keep that in mind too, that potentially could be something that happens to you. But if it's something you're really concerned about, or it's happened to you in one pregnancy and you want to talk further about it, come in and see us and we can come up with a plan that will help this. But I will tell you, I've taken supplements postpartum and I've done it not. I do feel like it's growing back faster now that I've been on the supplements, but I still went through that shedding period. There was nothing that my body was going to stop hormonally. It just needed its time to regulate. Sleep, taking care of yourself, exercise when you can, that healthy diet is going to be so important.
I love it. Honestly, you just gave us so much valuable information. I know I myself will be re-listening to this probably a multitude of times, especially post-birth, because I am going to be needing all of this advice. And again, a lot of my listeners are probably loving getting very informed, and I can go back and give this information to my sister and sister-in-laws and friends and send over this podcast episode once it's edited. And I know that they are going to highly appreciate it. And I know that you asked me, or you were rhetorically asking me, if I'm currently losing hair. I lose a little bit of it, not much. When I wash my hair, as you mentioned, not really losing a lot of hair. It's a big difference from when I was going through the telogen effluvium, that's for damn sure. And I have noticed that my hair is a little bit thicker. I don't know if it's just because I'm out of that phase, or if it's because I am pregnant and all the extra hormones and supplements and the prenatal. So it's probably a combination of everything, as you're mentioning. And I am trying to live and walk and try to keep my diet pretty healthy. Fingers crossed that things are good. As you mentioned, I am freaked out about losing my hair, because you kind of just already hit the nail on the head. Since I already experienced it one time, more than likely my body might respond in the same exact way post-baby. With that being said, you kind of already debunked some of these, but I looked these up online. Some myths about postpartum hair loss. One of them was, if you continue to keep taking a prenatal, will that help? If you shampoo less, will that help out? There's another one that said, if you continue to cut your hair, will that lessen the shedding? And then one of them, you kind of already said it a few times, sometimes you just need to wait it out until your hormones fluctuate back to normal. So taking a prenatal, shampooing less, or any of those things that are going to help out, or is it literally simply just like you have to wait out the 3 to 6 month period?
Prenatal vitamins are great to take all the time. I mean, if you're not on a prenatal vitamin, you should be on a multivitamin. So prenatal vitamins just have like a couple added extras that some multivitamins don't. We don't have any more children. I still take a prenatal every day because I just find them to be better. I tolerate them better. I've been taking them forever, and I do feel like they make a difference in my hair. I think any woman of childbearing age, kids or not, should be on a prenatal vitamin. In the event you do become pregnant, your body's already kind of like primed up for that. So like I said, nothing really is going to prevent this. This is a hormonal shift that's going to happen. You have to let it happen, and it will regulate itself. Taking a prenatal, I think, will help. Shampooing less, no, it's not going to make a difference. I think what happens, you lose more hair in the shower naturally. You're kind of like naturally dislodging hair because you're creating a little bit of tension on it when it's wet, or you're scrubbing your scalp. That hair you're losing, it's already detached from the blood supply. It's not your fault if you wash it or not that it's going to fall out more. Whatever's falling out, unless you're pulling it out or doing tight hairstyling, it's going to fall out anyway. So don't feel like washing less is more helpful. I have a lot of patients that come on here, not even postpartum, and they're like really afraid to wash. They wash once a week because, they're like, every time I wash, it's awful. If you're only washing once a week, yeah, it's going to be a lot worse when you're in the shower because you're dislodging a week's worth of hair loss as opposed to 2 days or 1 day, however frequently you wash. We really encourage you to wash every other, if not like every third day. Washing less than that, you can end up with a lot of buildup on your scalp that can really kind of block new healthy hairs from growing in. So we encourage every other day to keep your scalp nice and healthy.
Awesome. Well, honestly, I fully enjoyed having you on this podcast. It was very informative. And again, this is my first child, and I'm more than halfway through my pregnancy, and I've experienced a lot of crazy things, a lot of good things, like to be honest, and I've mentioned this on podcasts previously to my listeners, but I guess I'll mention it too now. My fears of getting pregnant with the whole, I thought I was going to be really nauseous the whole time and not being able to sleep and all those things have been a lot better, knock on wood, than I thought that they would be. So I'm hoping giving birth and post will be just as good, but I also am trying not to be naive, and I want to be aware of the things that could potentially happen, because again, even during my pregnancy, I'm starting to get a little bit of swelling in my feet. And like I said, hormonally, like I definitely do, in my opinion, smell a little bit different. Like I'm craving different things, and I do get hot. Like right now I have TMI, but I have like the underboob sweat as we're doing this interview. So
yeah,
I'm noticing all of the things, and I'm excited to give birth and have my son here. But like, as you mentioned, it's incredible what our bodies can do. As we start to wrap up this episode, because I know you probably want to get back to your husband and your kids, and I appreciate you having you on here, and I'm sure I'll have you back on here again sometime in the new year or maybe after the holidays to catch up on what you're doing and maybe talk about Medi Tresse a little bit more, because you're always very informative. Any last words on postpartum or any advice for my mamas that are either A, trying to get pregnant, or B, that might currently be pregnant?
I mean, this is not like hair related either, but I think one of the like things I wish that I focused on with my first pregnancy was really, I think in all honesty, like full transparency, I was just really terrified about giving birth. I didn't even think about what it would be like when my child was actually here. And I think that's why I struggled so much. Try to just know, like, no matter what birth plan you have in place, and I'm knock on wood, I was very lucky. I had like very easy deliveries, and nothing went wrong, and the babies were all healthy and are still healthy. I think I was so fixated and so anxious about giving birth and not getting the hospital in time, things like that. Don't focus on that stuff. Whatever's going to happen is going to happen. These people do this all day, every day, that you're in the best hands. Try to just focus on like these moments when you come home. Like, remember those times you walk in the door with him or her the first time, introducing him. I know you have a dog. Like, I just remember introducing him to the dog, like things I wish I just paid more attention to than being like so concerned with like, oh my God, what day is he going to come on? When should I stop working? Just things like that, and try to enjoy it. It's tough, but like I said, it just goes so fast. You won't be breastfeeding or bottle feeding for long. Next thing you know, they'll be walking and talking, and you're through it, and you're through the tough phases. And just know all of these stages are temporary. Like, you will not be this sleep deprived forever. Your body won't feel and look like this forever. You will get back to feeling like a human being, and just try to, take all the support you can kind of get.
That is some excellent advice. Thank you so much. And with that being said, that kind of was some positive pop, but I'll have you maybe give us some unrelated to birth or motherhood positive pop. Positive pop is anything that gets you up and moving and motivated, whether that be like a positive mantra or some words of advice or encouragement, kind of like you just did. What is Sarah's positive pop?
I'm lucky if I see them in the morning when I head out to work, because they're all still sleeping. I'm very lucky that I work part-time and I have plenty of time with my family, but I think it's so nice when you do get your time to like kind of be yourself again, get back to work, get back to, the gym or whatever that is for you, to kind of like use your brain or your body that helps you the most. And just when you do come home and the smiles you see on your kids' faces, there's just nothing better than that. Taking care of yourself is just as important as taking care of them, because if you're not taking care of yourself, you can't take care of them.
Excellent positive pop. And I love all the advice. And for my listeners that are tuning in, I know you guys fully enjoyed this. I know I've been getting requests a lot lately to do more motherhood type episodes, especially with me being pregnant. So I appreciate you coming on here. I look forward to having you back on here. Please enjoy the rest of the summer with your kids, your family, your husband. Maybe you'll go on a couple more trips. We will definitely be in touch. Once again, guys, to wrap up this episode, please go ahead and check out meditresse.com. That is meditresse.com. You can obviously book an appointment or a consultation with Sarah or anybody else that is there. If you're in a different state, you can also book through them as well. Once again, I just want to thank you for coming on here. You were absolutely fantastic.
Thank you. Thanks for having me.